Learning Foundation, and very happy to be sharing this few minutes with you for our social working for a few minutes before our reach meeting starts.
Okay, wonderful. And so we already did a little demo. There's so many people already in the room 1 hour before when I opened up our Zoom studio that we did a little bit of a test. I still have, and I'm going to, I suggest we do another one. So for those of you, but this time I'm going to share the instructions before going any further. So for those of you who have never used the breakout rooms, you can actually make sense of what we are offering here. So this Zoom studio right now is a single room. If you've ever been to a training or a conference when then people first gather in the plenary and then go to a smaller rooms to have sort of more individual meetings, that's exactly what breakout rooms are in Zoom. So you should see on your screen a little icon for breakout rooms. It's the 4 little squares. If you're on your phone, then it looks the way it's showing on the left-hand side. If you're on your desktop, look for this. You may not see it yet because it should be automatic. So what we're going to do is, let's see, we have around 35 people in the room right now. So we're going to, let me see. We're going to do a 5-minute session just to give you a taste of this networking. Will include panelists and attendees. Panelists can choose their room. Attendees are assigned automatically. Oh, wait, we created. All right. So we'll create 20 breakout rooms. So there'll be either 2 or 3 people in each room. Okay, actually, that looks like too many rooms. Right. Okay, there. So make sure in order to participate in this, you need to check your audio is working. Use a headset. That's key. You need to join the breakout room. So that's the little icon that I showed here. I'm going to paste it, see if I can paste it in here. Make it easier to for everyone to follow. I'm just going to see if I can make this, resize this a little bit. Okay, there. Just in case. So if you get disconnected, the same thing. You'll need to go through the through this little breakout room icon, and we're going to do 5 minutes, and we're going to see how well it works. You'll be in the room with 1, 2, or 3 other people. Your goal is simply to introduce yourself and introduce your organization. Remember, so this is right now. This is still a test. We like to use this time. Remember, we are 25 minutes away from getting started, but we're going to now open up all the rooms. All right, so here we go. You should be automatically sent to a room. Should be happening now. Otherwise, click on find the little breakout room icon and go there. We'll be looking at to see who is actually joined the room. This plenary room should gradually empty, and you should find yourself in a breakout room with 1 or 2 other people. Do introduce yourself. And introduce your organization. All right. Okay, so please. Okay, here we go. You need to find that breakout room icon and click on that, and then the rest should happen by itself. If you're still in the room, it usually means you're using a very old version of Zoom. And then with Maria, you should be able to, as the co-host, you should be able to go to whichever room you want. So we're going to go check on a few of the rooms. Again, your only purpose is to introduce yourself.
I'll drop by.
And your organization. All right. I'm going to go have a look to see what's happening in the rooms. All right, welcome back. I managed to visit just a few of the rooms and saw in some cases some people were not speaking and did not unmute. So again, the whole point of this Reach for Leaders is for you to be able to engage with other leaders. So make sure, check your equipment, make sure your connectivity is good enough. You don't need to turn on your webinar, but do at least turn on your audio. If your audio really is not working, the recommended approach, as you know, is to then share your messages using the chat. So, all right. So that was a first attempt, and this is precisely what we'll be doing. Remember when we introduced the Reach initiative? Let me just find the slide here. We said that we would offer special networking for leaders, one-on-one meetings, and dedicated communication channels. So today we are offering 1 and 2 on this list, and then the dedicated communication channel will come afterwards. So we are, for everyone who's joining now, you're not late. We're 17 minutes away from opening up the session. Let me go to Ambassador Hudu, and I'd like to ask anyone who'd like to share who they were able to meet, were they able to have a productive meeting, or did they find themselves in a room where everyone was silent? Would love to hear from you, Ambassador Hudu. Over to you.
Hello, good afternoon, Reda.
Yes, greetings.
Good afternoon. Yeah. So I was able to meet Inuka from Kenya. We're able to speak length to length, and it was interesting introducing our organizations and what we do. And we really have a very good discussion. And in fact, we were still on when the whole thing went out. Maybe we have a limited time. Yeah. So that was very interesting, hearing from her, the organization, what they do, and also for her hearing from what we do in our own organization. And it was very fantastic, actually.
Okay, so wonderful. Yeah, that's good. And can you tell us which organization you are representing today?
Empowerment for Vulnerable Women and Children International, that is EVOCH, in Kano, Nigeria.
Okay, thank you. And is there anyone else who'd like to share around this? We just did a 5-minute test. Of course, there are more people who've joined since. 5-minute test of what we're going to be doing during this Reach for Leaders session. So this is one of the partner coordination calls in the countdown to Teach to Reach. We're actually going to check how far away we are from Teach to Reach, and you can easily do that by going to the Learning.Foundation website. I'm going to go here. You can see here, we are now 28 days, 19 hours, 45 minutes, and 42 seconds away from Teach to Reach 11. And today, what we're hoping to do for the very first time is really specifically for leaders of organizations. Now, that could be a local government agency, that could be a national Ministry of Health, so it could be from government, or it can be from civil society. A civil society organization of any nature is welcome here. So we're really looking forward to facilitating this Reach for Leaders session today. And again, offering 3 very specific and we hope tangible opportunities. One is really special networking for leaders. Number 2 is one-on-one meetings. And then number 3 is really that dedicated communication channel. So we're 15 minutes away from getting started. And I believe that Charlotte Igbu has just joined us. And for those of you who do not yet know Charlotte, she'll be introducing herself. We're 15 minutes away from getting started. Charlotte?
Hi, Reda. Hi, everyone. So, as Reda said, I'm Charlotte Igbu, and from the Geneva Learning Foundation, joining from Ebolova in Cameroon. And it's, as always, a real pleasure to connect with leaders of organizations that are directly involved in serving communities and helping them find solutions to the critical challenges that they face. So, as always, look forward to the conversation today, and I hope that there's going to be, as Reda said, real experience sharing amongst organizational leaders and also learning as part of our Reach for Leaders. Thanks, Reda.
All right, wonderful. And then we also have, of course, many of you have had correspondence, shall we say, with Dr. Maria Fernanda Manzan. Maria, warm welcome to you.
Hi, Rita, and hi, all. Thank you very much. I'm loving loving to see the picture now. But yes, I've spoken with a lot of you, and we've done a lot of WhatsApp and email exchanging. So yeah, looking forward to a lot of things. I've also been in a very quiet breakout room until. We started speaking about not being shy and how taking advantage of these minutes that we are together to introduce ourselves and to learn more about each other and what we're all doing in our fields.
Yeah. And that's thanks, Maria. And we do speak about joining the Teach to Reach family. Let me add there's one thing missing here, which is, we do speak about, and quite fondly, of joining the Teach to Reach family, which is this global family of people committed to working for health and doing better for their communities, the communities that we serve, but also doing better for themselves. And we've seen, in many cases, very rapid career progression for Teach to Reach participants, receiving promotions and being able to advance in their careers to make even more of an impact. And we believe that's actually very important to the very important part of the Teach to Reach process as well. We're 12 minutes away from getting started, so I'm going to share some of the links. Let me just see. So first of all, if you have not seen this yet, for those of you who are here early, we'll share this. We have what are called the shared experiences. So I'm actually going to go and show you how that works. So for those of you who participated in Teach to Reach 10, and please type yes if you participated in Teach to Reach 10, please type yes into the chat, or actually type 10. We'll do something a little bit different. So just type 10 if you participated, if you were there for Teach to Reach 10. Charlotte was there, of course. All right, anyone else? All right, Maria was there, Ambassador Hudu, Tina, Tulisi, Mazia. So two things. If okay, looks like only okay. Thank you. So you can see there were nearly 2,000 experiences shared, 600 of them in English, and this Teach to Reach shared experiences is the compendium of all that was shared at Teach to Reach 10. So I encourage you. For some reason, there's a bug here. I'm not able to. Okay. Not able to visualize it, but you can download the file, and that's the important part. So I think that's one really important resource to share. And it's really, for those of you who've been receiving Teach to Reach questions, we really strongly encourage you to, of course, to respond to the questions that are meaningful to you. Don't answer just anything, but where you have actual experience with the question or with the issues raised by the questions, then by answering the question, you're contributing. You could be helping a colleague who's being confronted with the same challenge or problem. You could also find in the answers, and we just showed the experiences shared for Teach to Reach 10. We'll have a similar collection for Teach to Reach 11. You can also find solutions in that sense. So I'm gonna leave you with Maria, who's going to be doing the last final few minutes of social time, just asking you to speak and introduce yourselves, and then at the 2-minute mark we'll be kicking off the final countdown for this first Reach for Leaders session, which is part of the Teach to Reach coordination with partners, but it's really something new that we're offering today for the first time.
Thank you, Rita. Well, yeah, taking advantage of these next 7 and so minutes, I would like to invite you to introduce yourself. I don't see any hands raised, but as we were saying earlier in our breakout room, it's not time to be shy. We are here to learn from each other. So I'm inviting you to raise your hand to let us know. There's a lot that have been just sharing that you've participated in Teach to Reach 10. Boma Otobo, would you like to share with us what you will introduce yourself and let us know what you've learned? I've just asked you to unmute. I'm not
So
sure
Boma's not
if you
actually
can.
connected to the audio, so she's probably busy. But there are
Oh,
other people where
okay.
you see the
No
microphone's muted.
problem.
You click on "Ask
There
to
we go.
unmute," and that should connect you with the person if they're
Perfect.
available.
Thank you so much. Okay, Millicent, would you like to share with us? I would just ask you to unmute, or Faraja also. Um,
Okay, sorry, I am actually on transit, so my
no
background
problem.
is too noisy. Don't know if you can
No,
hear me.
no problem. We can hear you. If you have a few seconds and you want to introduce yourself, we can hear you.
Okay, my name is Boma Otobo. I work at the Primary Healthcare Development Agency. I retired from there as Deputy Program Manager of the NERIC is the National Emergency Routine Migration Coordination Center. So the last teaching teacher, I was able to network with some friends, colleagues all over. And one basic thing stood out for me. There was one of them that is in Ghana, and she actually shared her experience on how malaria vaccine was introduced in Ghana, and I took a lot from her. So I always look forward to other versions of the Teach to Reach, but there will always be something to pick up from other colleagues. I think I would stop here. Thank you. Over.
Thank you so much, Boma. Thank you for sharing. I have Dr. Manisha. Do you want to go ahead?
Yeah. Hello.
Yes, we can hear you.
Yeah, myself Dr. Manisha Dhanane from India, Maharashtra. I have attended all the programs, near about all the programs of Teach to Reach till date. And the only one thing I understood is universally we all are working for the same causes, and sharing within the network sessions gives us more capability and understanding of how other countries are working, and this is how we can contribute to our nation and share the keynotes to empower ourselves with the same having similar conditions in each and every country, how they deal with their pollution or environment conditions. We are helping our nation by giving our thought process. Thank you.
Thank you so much, Dr. Manisha. You're very right as what you're sharing, and it's wonderful to have a fellow scholar here. So I'm asking Thompson Igbu if you can unmute, that you also shared with us that you have participated in Teach to Reach 10. And at the same time, I'm asking to Leslie, I'm sorry, I'm very bad at pronunciating, to also share, as you were telling us that you did participate last time. Tina, I'm sorry, I started with all the T's, but if you are able to speak just shortly, as the rest have just done, short introduction, and let us know why you're here, what you've learned from Teach to Reach 10. If you have, oh, Rebecca, you can go ahead. I see you have. Okay, go ahead, please introduce yourself.
All right, thank you very much. I am the Dr. Thompson Igbu. I work in Sierra Leone, in the WHO, Sierra Leone Supporting Immunization Program at the national level here. And it's always been exciting participating in the Teach to Reach activities, or the programs rather. And the last one, Teach to Reach 10, I engaged a good number of colleagues from different countries. One particular one that catches my fancy is a colleague from the northern part of Ghana, where we discussed particularly the issues of climate change and how climate change is impacting on health generally. For me, that was quite interesting thing to hear how climate change actually is impacting on health in the areas of even in the areas of how people are beginning to move, shift in terms of their location, because it was saying that in some parts of the northern region where the climate is a little bit more harsh compared to the southern parts, realize that that is affecting even the way people behave. Even their income is also affected because of crop management or agricultural produce and all that. And that is having an extended impact on their ability or their income level to be able to support health, including their access to health as well. So all these, factors, coming one way or the other to affect how even immunization services is rendered. Initially, it looked a little bit not too clear, but on the second thought, when you look at it, you connect the dots, you realize that climate change actually is also affecting health, and by implication also affecting immunization in some parts of the world. So for me, that was a good takeaway. Otherwise, I keep saying Teacherate is a good platform, and I want to say thank you very much and to the organizers, to Reda and his team. Thank you.
Thank you so much, Dr. Igbu. We're almost at the 2-minute mark, so we're going to be launching very soon. Back to you, Rita.
Thanks, Maria. Yes, indeed. In just 2 minutes and 10 seconds, as you can see here, we're going to be starting this special, exceptional meeting of the Teach to Reach Coordination Partner calls as we count down to Teach to Reach for Anglophones. That'll be on the 5th of December 2024. So we can check on the Teach to Reach page. Here you can see that Teach to Reach is 28 days, 19 hours, 31 minutes, and 40 seconds away. Now, what's going to be different about today's session is that we'll be focusing on reach for leaders. And what that means is we told you that there would be networking opportunities for organizational leaders. We're actually going to do it today. So we're looking forward to your participation. We'll explain the process, how it's going to work as we count down to Teach to Reach. And we do have one of our global partners who is joining this call for the second time, but who previously was not able to talk. So before we kick off with the briefing, we'll be inviting Antonio Pizzuto to introduce himself and introduce his organization as part of the focus on malaria for Teach to Reach for Teach to Reach that we started in June 2024. So we're 40 seconds away. Antonio, thank you for joining us. I hope that you'll be able to stay for the networking to meet organizational leaders from all over the world who are participating in Teach to Reach. We're now 30 seconds away. Right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki. I'm here with Charlotte Igbu. Charlotte, how are you doing?
I'm doing great, Reda, and warm welcome, everyone. It's a pleasure, as always, to connect with you today.
As well as Maria Monzon. Welcome to you, Maria.
Thank you, Rita. Good morning, good evening, good afternoon. This is Maria. I'm joining from Corrientes, Argentina. Very happy to be here.
All right, thank you for all of those of you joining wherever you may be. Warm welcome to this briefing for partners. We'll start with a briefing, but actually today we're doing something new, something different. We're not going to ask you what is Teach to Reach in one sentence. We are going to carry out the promise that we made when we announced Reach for Leaders 2 of the partner coordination calls ago. Very quickly, Maria Monzon is going to introduce the Teach to Reach partnership process, walk through a few slides with the briefing information. The rest of the session will be dedicated to small group discussion with other organizational leaders. You can see we'll put you into breakout rooms. If you've never done those before, just make sure you check your audio, use a headset, make sure that you're ready to introduce yourself and your organization and to share your challenge and share your experience. And if you get disconnected or need to rejoin the session for any reason, you look for the breakout room icon. That is how you will rejoin these sessions. But before we go any further, we're actually going to hear about malaria from one of our key global partners for Teach to Reach 11, and that is RBM. You may or may not have heard of RBM. We're going to invite Antonio. Antonio Pizzuto.
Hi, Reda.
Yes, warm welcome to you, Antonio.
Can you hear me? Yes, hi, Reda. How are you? Really happy and excited to be here.
Wonderful. So can you introduce RBM? Tell us what its mission is and what you actually do.
Okay, thanks a lot, Reda, and good afternoon, everybody. Well, I'm speaking today on behalf of the RBM Partnership to End Malaria. The RBM, which means Rollback Malaria Partnership, is a partnership hosted by the UN, by UNOPS in particular, and we are the global coalition dedicated to eradicating malaria once and for all. Our partnership gathers and unites over 500 organizations from across different sectors, such as governments, NGOs, the private sector, research institutions, civil society, and foster alignment and coordination to streamline efforts for global malaria eradication. We believe that through coordinated action, advocacy, and resource mobilization, we are driving forward all the initiatives that aim at eradicating this disease from our planet. And well, Reda, since I have the floor, let me also tell that I'm also delighted, we are delighted as RBM to express our excitement and commitment as a partner of the Geneva Learning Foundation. And we believe that this collaboration represents really a unique opportunity now to drive forward our shared vision of a malaria-free world. And we also feel privileged to sponsor this year's Teach to Reach event, which for us is a remarkable platform for knowledge exchange and capacity building. So over to you, Reda. I'm really happy to be here.
Wonderful, wonderful, Antonio. Thank you, and welcome to the Teach to Reach family. You're here in the room with health professionals from all over the world. We're going to, before we do the briefing, we're going to give you a taste of what we'll be doing through the Reach for Leaders initiative. So here we have what we announced is special networking for leaders, one-on-one meetings, and then a dedicated communication channel. Today, we're delivering on number 1 and number 2. And to give you a taste of what that looks like, we're going to put you into breakout rooms. So we're going to try to do so that, let's see, that we have 2 or 3 people in each room, maybe 4, up to 4, let's say. And we're going to give you just 5 minutes right now, but we'll do a more extended breakout after the formal briefing. So if you've never done this before, you're going to find yourself in a small room with 3 or 4 people. Get ready to unmute your microphone. That is absolutely indispensable. That is the point of connecting with others. So use a headset. Now, if your headset or if your connectivity is too poor, you can use the chat. Introduce yourself and your organization. First, share your challenge and then share your experience. And you know that we've asked you questions in the plenary. What's the biggest challenge faced by your community? What question would you like to ask to fellow health workers? How will this help your organization? What's your organization's experience of Teach to Reach? How has your organization applied what you learned from Teach to Reach? So these are all the kinds of questions that you can discuss together. All right, is everybody ready? Here we go. You should be taken automatically to that room, and you should find yourself with 4 or 5 people. Here we go. and you'll have just 5 minutes. You should be taken automatically to the breakout room. If that doesn't happen, then by all means, what you need to do is to click on the little breakout room icon, and then that should take you automatically to one of the rooms. We'll be together with Charlotte and Maria. We'll be visiting the different rooms, and if for any reason you are still stuck in the plenary, almost all your colleagues are gone, this is how you join breakout rooms. On the left-hand side is what you should look for if you are on your phone. Look at the bottom. You may need to scroll. There's a little to find that breakout room icon. Sometimes it's hidden under the more. You see the 3 dots in the circle, whatever the case may be. The only other reason for why you may not be able to join the breakout room is if you are using a very old version of Zoom, perhaps on an Android device that is not able to use the latest version. So if that is the case, we really urge you to do the needful to update your Zoom app, and you should be able to get the latest version of Zoom here. So now with Charlotte and Maria, we'll be visiting the rooms. Right now, it looks like most rooms have at least 3 organizational leaders, Teach to Reach partners. Yep.
Hear me earlier?
Hello, can you hear me?
Yes.
Okay, how is everyone doing in this room? Surya Prakash, have you been able to introduce yourself? The same question for Maria. For Mario, for Dr. P. Sarma, and then for Tina. And glad to see you are in this room, Antonio. Please do go ahead and introduce yourselves and your organization, and then share a challenge that you face and your experience. You only have just a few minutes, so I wish you luck. We're with the Teach to Reach team. We're going from one room to the next, making sure everybody's okay. Tina, are you able to speak?
Yes, Reader.
Okay, wonderful. Dr. P. Sarma, are you there? All right. Dr. Sarma, please do introduce yourself. Mario.
Good evening, guys. I am here. Dr. Sharma here from India.
Okay, wonderful. So you do not need to wait for me to ask you. Really introduce yourself and your organization, and then share a challenge that you face and your experience with that challenge, please.
Okay, Reader.
All right.
Hello.
Hello, Mr. Lawrence.
Yes, please. Thank you.
And as
How
you
are
grow,
you?
can do it, all of this. As you grow older, as you grow, the eye changes.
Good afternoon.
Yes, I joined the main group quite late, so I did not capture well the purpose of this break
Okay,
break room.
Lawrence, I can help there. With our team, we're going from one room to the next. Introduce yourself and your organization. Share a challenge that you face in your organization, and then share your experience. But start with the introductions. You only have a few minutes. We'll be going back to the plenary room in about 30 seconds.
So thank you.
Yes, we can.
Okay, my name is Trevor Jimin. I work with Benue State Ministry of Health as the director of planning and statistics, and retired.
Sorry, I didn't get your location. You said Aka is from Cameroon or where?
No, I
I think I heard you say South Korea.
Anything?
All right.
Okay.
Welcome back. You just had just 5 minutes. Should have everyone back now. Oh, we still have 27 seconds, so some of you are not yet. Not yet back. We have all the breakout rooms are going to close in 10 seconds. And now everyone will be coming back in. Here we go. All right, welcome back. Welcome back. That was your first taste of the networking that is really core to Teach to Reach, but this is the first time that we have really gathered leaders of organizations, everything from a local government agency or health center to a civil society organization of all shapes and sizes. So we hope that at least some of you were able to share. We're now going to do a second session, and this time you will be in with a different group, and we hope that this time, for those of you who are confused by what exactly you were supposed to do, let me review the guidance again. There are really 5 steps. So first of all, check your audio. Make sure you're using a headset is preferred. Otherwise, there can be static or background noise. Join the breakout room. That should happen by itself. If it doesn't happen automatically, then click on the little square. So not on the screen, not on the orange slide, but in your Zoom interface. If you're on your phone, you should see it at the bottom, as shown on the left-hand side here. And if you're on a desktop or laptop, then look for that little breakout rooms icon. That's how you get in and out. Introduce yourself and your organization. You can go one by one. Share your challenge and share your experience. All right, so we'll do another round of 5 minutes, but this time with a completely new group of people. So you will not be meeting the same people again. You'll meet a new set of people, and this is just a taste of what we'll be doing as part of the Reach for Leaders. That is relate, engage, act, connect, and help. Here we go. And we do encourage you during that time when you are together, that's when you can best share your contact details, WhatsApps, and so on. But if you do not get immediately taken to the breakout room, then you may need to click on find the 4 little white squares and the label breakout rooms, and that should take you there within a few seconds. If you're using a very old version of the Zoom application, you may be stuck in the plenary with us. And so introduce yourself to share a challenge that you face. We still have 27 people in the room here. You should be taken automatically, but it looks like Zoom webinars may handle this a little bit differently, because in Zoom meetings everyone does get. So it may be. We urge you to upgrade your version of Zoom. Let me see if I can find the download link. I believe this is I urge you to go download the latest version of Zoom for the next session. Don't try to do it today. Okay. So as there's a significant number of people who are here, let me see if there's, and you're not showing up actually. Let me see if I can ask you. So there is an option to ask you to join for those of you who have not yet joined. And for Lawrence and others who are sharing their contact details, we'll be setting up a communication channel so that everyone can share contact with everyone else. We'll also be organizing what we call a remote coffee, so you can really have that opportunity to share on your own time, at a time of your own choosing, together with another organizational leader to really share in the ways that you find most useful. All right, I see. And it does show only a limited list. So you should see a request to join for some of you, but this has to be done manually by our team. So we've been doing some of that, but there's still 25 of you left. There's a minute and a half. Please raise your hand if you'd like to share. Introduce yourself, introduce your organization. I believe Kumpatala Uma Shankar, you had requested to speak, but you weren't sure how to raise your hand. So you should look for the raise hand icon. Kumpatala, are you there? Are you able? I'm asking you to unmute. We would love to hear from you. And then let's go to Dr. Sajal Dutta. We've just got a minute before everyone comes, a minute and 30 seconds before everyone comes back. Dr. Sajal Dutta, you're a longtime scholar, Teach to Reach leader. We'd love to hear from you. We'd also love to hear from you if this is your very first time joining a meeting like this. We're now going to mark a pause to go through the briefing for partners. That is what Maria Manzan will be presenting. We won't be asking you the questions interactively. We'll just show you the questions to think about. And then the rest of the session before we close at probably the 45-minute mark will be dedicated to networking. We'll put you into you'll go back into breakout rooms and you'll be able to share in this way. So I've asked Kumpatala Umashankar to unmute, but Kumpatala is not responding. Patience Monier, please go ahead. We'd love to hear from you. Don't forget to introduce yourself and your organization.
Hello?
Yes, a warm welcome to you.
Hello?
Yes, we can hear you loud and clear.
Can you hear me?
Yes, loud and clear.
All right. Patience Monye from Kemp Foundation, Lagos, Nigeria. I was in room 3 with Chinwe, Lawrence, Goody, and Deyo. We had self-introduction and our mode of operation from women organization, education, and we're not able to get through to every other person.
Understood, Patience. And did you enjoy connecting in this way in a small group discussion?
Yes, very, very interesting and interactive.
All right, we should now have everyone back in. It says the breakout rooms will be closing soon. All right, so here we go. Thank you. We'll be now going through the briefing. Yes, I think we've got everyone out of the breakout rooms, unless I'm mistaken. Yes. So We're now going to go to the briefing. You know that we always ask you what is Teach to Reach in one sentence. We're not going to do that today. Maria Monzon, so many of you have been in touch with her, is going to take you through the briefing. This is for those of you whose organizations are new to Teach to Reach. Of course, if you've already been through this briefing, just be patient. We're going to go through it quite quickly. The recording with more details is already available. We have lots of documentation for new partners, but we did want to review the basics, and then we'll go back to networking. So through the small group discussions, we'll be going back to that. Over to you.
Thank you, Rita. Okay, so as Rita was saying, this is going to be just a little faster because the idea of our meeting today is our breakout rooms and how we're working there. So what is Teach to Reach? It's peer learning for health professionals. It connects across countries and job roles. It supports local to global health initiatives. It builds robust networks, and it improves health outcomes. So there we go. Okay, so yes, 21,398 health professionals joined us last June for our Teach to Reach 10. So who were they? Most people who join Teach to Reach work in health centers or districts. Half work for the government and half work for community organizations. Half speak French, half speak English. Many work in difficult places. 62 out of 100 work in rural areas far from cities. 47 out of 100 work with poor people in cities. And 21 out of 100 work in places with fighting or conflict happening around them. Now, who would like to share how they are mobilizing their colleagues to participate in Teach to Reach 11? I would like to hear maybe only one, and then we can continue.
Actually, Maria, what we'll be doing this time is going through the briefing, but these are the questions that we encourage you to discuss, or you may have more interesting things to discuss, but these are questions we'd like you to consider when we go back to networking at the end of the briefing. So you should be able to skip right to the benefits of partnering. We're still seeing the who attends slide. Yeah. Okay. Great. Yep.
Oh, perfect. Okay, great. So here is how your organization will benefit from joining Teach to Reach. First, you will share what you know. Your organization works in health every day. You know what works and what does not work in your community. So at Teach to Reach, you can share this knowledge with others. Second, you will learn from others. We had a health worker from Ghana who told us about problems with illegal mining. It makes people sick and creates places where mosquitoes breed. He shared how his team works with community leaders to solve these problems. Other health workers learned from this experience. In third place, join a global network. You will meet people from 77 countries who work in health. They can help you solve problems, and you can help them. And fourth, help your team grow. Your staff and volunteers will learn new skills. They will practice sharing ideas with people from other countries, and they will learn how to explain their work better. Let me go through really quickly how you become a partner. So here are the 6 steps to join as a partner. You have to attend this meeting, so the briefing that you're doing right now. You have to fill out the partner form. That's how you apply. You have to tell others about Teach to Reach, that is sharing this announcement. You have to report activities, that is telling us who you told about it, who you're sharing about this. And in 5th place, get leadership endorsement. So you get your organization leader to write a support letter. We will share with you a template. Don't worry about that. And last, you will inform your team. So you will tell your team about it. If you've joined Teach to Reach 10, then you only need to do steps 3 and 4. Every person who attends this briefing will receive the step-by-step instructions. So don't worry about it. And you can always contact me by email or by WhatsApp if you have any doubts about this.
That's great, Maria. Thank you. And we're now going to do the practical activity.
Perfect.
So we're going to, And the practical activity is I'm going to be showing you how to do this. So we have just issued a new post to announce this network for health leaders called REACH. And so I'm going to share the link to the post and ask you to do 3 things: like, comment, and repost. Let me set this up, this link, right? So I'm going to share this in the chat so that everyone can see it. And I'm going to see, so I just clicked on this link myself, and you can see here, this is the announcement for today's session, but there'll be another session 2 weeks from today. So, and you can see already there have been many Teach to Reach leaders and other people interested who have shared it, but we want to amplify this further. You can see here, many of you have commented. So there's really 3 things. And rather than sit passively and listen to me, I'd like you to actually do this. You should be able to stay connected in Zoom. Just click on the link in the chat. And why are we asking you to do this? Well, for a very simple reason. In today's world, networking is the key. But for a network to be effective, the more practitioners, the more professionals, the more leaders join, the more likely you are to find the solution to the problem that you face, to connect with someone who's already faced this challenge and maybe has a local solution that you can adapt, that you can use. So 3 things to do. The first is like, so it's really that simple. The second is to repost. That's also just 1 click. And then the third takes a little bit more effort. You can do your own comment, of course, and I'm just going to post that I'm really enjoying the session. So I'd like to ask Faraja Chiwanga, have you done this? We're going to check in a few seconds if we've been able to add to make these numbers go up. Antonio Pizzuto, have you been able to like, comment, repost this post? Boma Otobo, Dr. Manisha Danan, Dr. Sajal Dutta, Kumpatala Umashankar. It's in your hands. All you need to do is like, comment, and repost. So I'm going to share the link again. And we'll be sharing, remember, we'll be sharing the directory of organizations with all your contact details, but you're free to share, and we encourage you to do so, to make those connections. That is really the purpose of this REACH network. Rebecca Chirenga, Thompson Igbu, Tulisile Mazia. I'm going to go back to this page, and we should be able to find the names of all the people who are in this room. I'm going to now reload the page. Let's see how we're doing. Okay, wow. Okay, we've now got 48 others. So thank you. That's amazing. Let's give a round of applause. This is really the power of the network, and these social networks are based on that power. Now, word of mouth is really powerful as well. Let's see how many have made comments. That's the only thing that takes more than 1 click. So you can see here, a good one, very informative. Think about what's going to convince your colleagues that you're connected to. And then we have already 15 reposts for this. Absolutely amazing. So a job well done, I would say. There is one more opportunity to share. And I'm not sure, sometimes it doesn't quite work, but I'm going to share a really long and super complicated link. Let me see if I can actually bring it in here. Yes. So you can see here, super complicated link here. And if you click on that, I'm going to do it to show you it's safe. You will get to send the following on WhatsApp. Okay, unfortunately it says Teach to Reach 10. Let me see if I can fix this. So it says 11. I think that would be better. Yeah, so I'm going to delete that and just repost here. So click on this link. Sorry, apologies for sending an old link, but this is if you want to share this opportunity with your colleagues on WhatsApp, so privately, this is how to do it. So this, we can't ask you to show us, but yes, we trust that if you did such an amazing job here, you can see it's gone up further. We've got 56 likes, 38 comments, 31 reposts. Okay, wonderful. Another round of applause. And then back to you, Maria, for the next part of the briefing. I believe you have the timeline here.
Yes, Rita, thank you very much. Okay, so as Rita was saying, we have our timeline. And so here you're seeing my timeline, right?
Yes.
Okay, perfect. Okay,
So I'll be sharing the screen. You'll just have to tell me next slide.
Okay.
But there's one major change here that I think we need to highlight. We had initially planned for malaria special event to happen before Teach to Reach. It's likely to happen on the 10th of December. You heard from our esteemed partner from RBM, really the partnership to end malaria, Antonio Pizzuto. So we're working with them, and we'll have a bigger announcement to make very soon. I believe it's due for the 11th of November. The rest of the timeline, I think we've already gone over. Maria, I suggest we go to the Teach to Reach step by step, and this is especially for new partners. We realize that some of you have already listened to this briefing, have already answered questions, but we really want to make sure, because there's so many new organizations joining Teach to Reach really every day, we want to make sure everyone is on board. Back to you, Maria, with slide.
Perfect. Thank you, Rita. So I'll just go fast through this slide. So as Rita was saying, Teach to Reach questions. Okay, let's just go to this. So what we want everyone in your organization is to join Teach to Reach. So here are 3 ways that you can help them. First, you can organize watch parties. So this is where you find a computer or a phone and you gather people to watch Teach to Reach together. Another idea would be group discussions. This is when we send questions, you read them out loud to people who cannot read well. You talk about the answers together, you write down what everyone says, and then you can send us those answers. And another idea would be to use a community radio. So if your organization uses regularly the community radio, you can talk about Teach to Reach questions on your radio program. And then you can tell us what your listeners said. If you have any ideas or how you can include more people, we are really wanting to know them. So please share them. And we're back to Reach for Leaders. This was what we were sharing earlier. So this is something new that we're doing for the first time at Teach to Reach. And Reach stands for, the R is relate. So you connect with other leaders, you engage, you share your ideas, you act, you connect, and you help and support each other. We're going to the activities. So we will have special meetings just for organization leaders during Teach to Reach 11. And here you can meet other leaders and talk about working together. Then you will get, your organization will get, related to partner visibility, your logo on the Teach to Reach website. Your organization will be listed in our partner book. Tools, you will send you tools to help you tell others about your work. And then you will get a chance to join our social media team. Okay, last time, 4,081 organizations joined as partners. They came from health centers, from district offices, and from ministries of health. I will go quickly, next please, through the next steps. So remember, you have to register. There we're changing our dates just to update it. You have to register individuals, and then you have to apply as an organization as soon as you can, okay? Tell others about Teach to Reach. This is sharing the announcement. Get your team ready, and then join us on December 5th and 6th for an amazing Teach to Reach 11. At Teach to Reach 10, we saw organizations working together in new ways. We want your organization to be part of this too. If you have any questions.
Yes, Maria, if there are any questions, you can use the Q&A tool that I think is available in this session. We don't see any questions yet or in the chat. And I think most of you, there are certainly newcomers, and we want to warmly welcome you to the Teach to Reach family. And many greetings in the chat. So I suggest we go back to really what we were eager to try, and today's an experiment, and we'll be looking for your feedback. Very important. As soon as you close the Zoom room, you'll be invited to take a quick survey asking you 5 questions about your experience, and this is on the basis of what you tell us in your feedback. This is how we will decide if we will do this kind of networking in small groups again ahead of Teach to Reach. So let's now to explain how the networking is going to work. Check your audio. You are going to be expected. You're going to find yourself in a room with maybe 2, 3, 4 other people. And the point is for you to meet, network, and learn about each other, about your organizations, about the work that your organizations are doing, about the challenges that you face. So you're going to join the breakout room. It doesn't happen automatically. You should find the breakout room icon. That's the 4 little squares that you see. And then once you do join the breakout room, introduce yourself and your organization, share your challenge, and then listen to others to share your experience as well. How to join, again, if you're on your phone, that's what you see on the left-hand side. You look for the little 4 squares together. One of them is filled out. I think that depends on whether the breakout rooms are active or not. And then on the right-hand side, you see what it looks like if you're on the desktop or a laptop. So that's really what we're going to do for the rest of the session. We're going to do that for about 14 minutes to give you more time for those of you who joined early or who were here from the start of the briefing. At least you've already done a networking session. This time we are going to go for a little bit longer. And this is just a taste. We'll be doing this at Teach to Reach 11. We'll be doing this in the next partner coordination meetings. We encourage you to share your details. Remember that we'll be sharing a directory of all the organizational partners who've joined Teach to Reach. So without further ado, Ayob Hailu, who wants to know how can I reconnect to the previous group? We're actually going to put you into new groups, I believe. Let me see if we have how we can do this. Yep. So we're going to recreate the groups, and this time, we're going to create 20 groups here. All right, so there should be a few of you. We're going to do 15. Let me see. 15 minutes will be tight with respect to our next session for the francophones. Looking at Charlotte here, but let's do 15 minutes so everyone can enjoy and have more time to do this. So, all right, and here we go. All right, we're now opening all rooms. So you now have 15 minutes. You should be taken to the to your breakout room automatically. It will be with a new set of people. Your goal is to turn on your audio, unmute yourself, introduce yourself and your organization, share your challenge, and then share your experience. Of course, you're also free and encouraged to share your contact details with each other so you can stay in touch, even though we'll also be providing communication tools for everyone. Now, if for whatever reason, usually it's one of two things, either you're using a very old version of Zoom or you are, or there's an issue with your network. For whatever reason, those of you who stay with us in the plenary will be opening up the discussion in the remaining time, in the time that remains, with you for this the questions that everyone else is discussing in the breakout rooms. And I do want to ask, I think, Charlotte, if you could try to invite everyone who is still in the plenary to try to send them to their room. It's a little bit tricky, unlike the Zoom room breakout groups. And then I'd like to ask Maria, if Maria, you could we could work on this question again. So really, let me find the around how many people from your organization will participate in Teach to Reach 11. We would like to ask those of you who are here in the room with us to tell us more about how your organization is mobilizing staff, volunteers, community members for this purpose. Over to you, Maria.
Thank you, Rita. So yes, as Kumpatala, I'm asking you to unmute. Can you share with us if you're able? We shared a room earlier, and we would like to know how many people from your organization will participate in Teach to Reach. Joyce, I'm also asking you to unmute. I see you here. If you're able to, or Justina, if you would like to share with us how many people from your organization will participate in Teach to Reach. I see Anifat is also here. I'm asking you to unmute. If anybody has connectivity issues and wants to let me know that you're unable, that's fine. I also see Mofat. I'm also asking, I don't see any raised hands, so I'm just going to invite you to share with us how many people from your organization will participate in Teach to Reach. I see Sadia also asking you to unmute if you would like to share with us. Aishatu or Ajay patients, I would love to know how many people from your organization will participate in Teach to Reach. Joyce, I'm also asking you to unmute if you can, if anybody is available. Dr. Thompson, if you want to share, we heard from you earlier, but we'd love to hear from you again. If you're able to unmute and to let us know how many people from your organization. This is a very quiet group, but these are not times to be shy. So,
Okay,
just
Maria, I see you're not having
you.
much success here.
No.
So yes, please, if you are in the, if you for whatever reason you haven't been able to join your breakout room, we do want to encourage you to speak. That's the whole point of Teach to Reach, is to hear your voices. So we're just asking you to unmute and encouraging you tell us about how your organization is engaging. Some of you have already done so, but we'd love to hear from you.
Hello.
Yes, Patience.
Hello. Yeah. Good afternoon. Good morning. Good night, everybody.
Wonderful to hear from you. Don't forget
I'm happy
to remind us who you are
Sorry,
and
I
where
was
you
in
work.
another meeting. Yes. I have been missing this meeting because of networks, and I'm just coming shortly into a network area. We're on immunization session right now. We're having campaign, measles, integrated measles campaign, together with OPV, oral polio vaccine. And
Wonderful.
it has been great. Hello?
Yes, wonderful, Patience. Can you tell us where you are calling in from?
I'm calling from Nigeria, Niger State.
Understood. Yes.
Mina.
And so, what is the organization that you are doing this work for?
It's not very clear.
And can you tell us, in addition to yourself?
Am I heard?
Yes. In addition to yourself, how many people
Hello?
from your organization will be joining Teach to Reach 11 on the 5th of December? All right, I'm afraid we've lost Patience. Yeah, so we just need to keep going. It looks like, I suspect that the people who are having problems joining the breakout rooms have connectivity problems, are still managing to stay connected, but have these problems. So please do unmute yourself if you see your microphone is active. Otherwise, raise your hand so we can go to you. Nazon Gadiadza, please go ahead.
Greatly appreciated, sir. Thank you so much. Welcome to Zimbabwe, Harare. It's where I'm calling you from. Yes, we have a number of people who are scattered throughout Zimbabwe, but particularly in this case, on the date in December, we will have 5 people attending the Teach to Reach episode. So that we may, at a later stage, during our festive season in Zimbabwe, where we have got a tradition of gathering people, enjoying festive, we can also share, take that opportunity to reach and teach others about these health issues that we are encountering in our country. Thank you.
Wonderful. Thank you very much indeed, Nazon. And is this the first time you're joining Teach to Reach?
No, this must be my 7th time.
Okay. Okay, wonderful. So you were with us in June. Was that the first time?
Yes, in June, that's correct.
Okay, wonderful. And what have you found? How has participation helped you? Why have you come back for more?
Yeah, the participation, especially taking information from others in Ghana, in Nigeria, when you hear people talking about problems that you are encountering also in your own country, like the gold panning issue, the unauthorized mining, where people gather for the sake of getting something on the table and ignoring their own health hazards exposed to them during those, because they will only be focusing on putting food on the table. But the dangers associated in terms of health, especially respiratory, skin diseases, and even unauthorized relationships, causing a number of problems. But overall, when we talk of malaria, it has been running havoc, and that's what we have been trying to teach each other and educate each other, so to be able to handle these situations, so to save life.
Mm-hmm. Very interesting and very good to hear that. And what is the one question one issue or one problem that you're especially interested in learning from your colleagues at Teach to Reach 11?
Yeah, one other problem that we are encountering is when these, the diversification of problems, the problem that my colleagues in Venezuela are, let's say we are talking about floods. Here in Zimbabwe, it's a hot country. The majority, we don't experience such floods that take longer. Otherwise, in Zimbabwe, they might take only, say, 3 to 7 days. The water is gone. We are dry again. So, to match those and try to get help from others for a situation which we think in Zimbabwe. Yes, we experienced the floods, but these floods are not prolonged. They naturally help themselves out. But the more important thing now is when they talk of floods and mosquito, from our side, we are talking of housing issues where people are put or maybe erected accommodation in unforeseen wet areas where water will gather after rains, and these people might also suffer floods in that area.
Thank you very much indeed. Let's go now to Rupi Origo-Misan. Rupi, over to you.
Yeah, I'm just joining now, so I want to get a clear understanding of what people are talking first before I can say something.
Can you introduce yourself and tell us what organization you're representing?
My name is Origo-Misan Rupi. I'm the program manager for Development Initiative for Community Impact in Nigeria.
Okay, wonderful, Rupi. Yeah, so we're asking, so is this the first time you're joining this session, a session like this one?
Yeah.
Okay.
Yes. This is my first time of joining.
All right, wonderful. So first of all, a warm welcome to the Teach to Reach global family of health professionals and health organizations and leaders. Were you able to listen to Maria Manzan present the briefing?
No.
Okay, so we'll send you. I'm going to share the link to the recording that you can find so that you can catch up. It will be available. It's actually already available. You can watch the full briefing that we had 2 weeks ago. That'll bring you in to the Teach to Reach family. I take note of Justine Namuli, who says that there will be 5 people from her organization who will participate in Teach to Reach 11. All right, let's keep going. We have 2 minutes. So what's going on while we speak? And this is something that we have never done before in the countdown to Teach to Reach. Teach to Reach is about networking, professional networking, so that individuals and organizations can make connections that matter. Today, we're hosting the very first Reach for Leaders. So Reach is relate, engage, act, connect, and help. And as we're speaking here in the plenary, there are hundreds of leaders from health organizations from all over the world that are in breakout rooms and that are getting to know each other. It's a very short session today, but we'll be doing more in the run-up to Teach to Reach 11 that will be happening on the 5th and 6th of December. And that is a new component to the Teach to Reach initiative, which, as Maria said earlier, the last one in June, around this banner headline of climate change and health, but also many other topics such as malaria, neglected tropical diseases, immunization, women's health, 21,300. It's actually 98. I think this has been a typo that's been persistent, but either way, it's a big number, and that is what Teach to Reach is all about. We've got 50 seconds, and then people will start coming back into the room. We'd love to hear from Chibioke Alagboso, let's say from Ememombong Koisa, asking you to unmute. Joyce Kira, still trying. We'd love to hear from Kumpatala. You expressed that you wanted to unmute, but we still haven't heard from you. Obiageri Iku, Raula Barake, Saidia Abdullahi, Susanna, and Koma Sare. We'd love to hear from you as well, but actually probably do not have time because the bigger group of leaders, these with us in the plenary, were just the folks who were experiencing technical difficulties. So we enjoy that, still hearing from a few people despite the challenges. So now everyone has 60 seconds to leave their breakout rooms and come back into the main plenary. We'll be very quickly closing this session because next we have the French language participants who are going to meet, network, and learn. All right, here we go. 30 seconds. All right, 12 seconds. We don't have a countdown here, but we should. Right before everybody comes back. And again, Teach to Reach is peer learning for health professionals. We believe it's the world's largest platform for peer learning where professionals can share with each other. Here we go. Everyone should be coming back into the room, and warm welcome back. We hope you had a productive session. Okay. So these were very short sessions. We're actually testing this Reach component of Teach to Reach. This is new. This is specifically for leaders and of organizations that are partners for Teach to Reach. Tafuroder Mutange from Kenya says, sharing ideas in groups has been very fantastic. Unfortunately, we do not have time to hear from perhaps more than one of you before we need to close down this session because we're starting up the session with the Francophones. Is there anyone? Please raise your hand. I've just lowered all the hands, but if you'd like to make a comment about what you just experienced, this professional networking, very quickly, you're going to have to be very concise. Please go ahead. Okay, I see Fatima Zara. Yes, Fatima Zara, please.
Hello.
You'll have the closing word.
Hi, Reda. Hi, everyone.
Please remind us who you are, what you do, and then sum up in one sentence what was your experience of the breakout groups and the reach for leaders.
Okay. My name is Mrs. Fatima Zara Abubakar Otaru. I'm a public health educator from Nigeria. This breakout session has been really beneficial to me because it exposed me to a lot, to know that, as I just discussed with a colleague of mine, whatever it is, you learn that you're not alone struggling in it, and you get to meet others that have either better experiences than you, and that also exposes you to learn from them, which is something I'm really proud to be part of this. Yes.
All right, wonderful. So that's it for today. We're going to start. Let us know if you have comments. Put them in the chat quickly. We'll be able to show them in the next 20, 30 seconds or so. If you'd like to tell us how it went, if you made it to the breakout groups. This was the first time we did a Reach for Leaders session. If you tell us, there's a little survey when you leave the studio. Tell us how it went. We'll be looking at that, and that is how we're going to decide if we should do this again. Once again, thank you, and really an impressive group of leaders from all over the world. We appreciate your participation, your trust, and we look forward to, yes, we'll definitely be giving more time. All right. Take care, everyone.